Being blindsided by huge medical bills can be a tremendous financial hardship. But a new law currently being considered in the next stimulus bill could lessen that burden. Eyewitness News reporter Jeremy Baker explains.
It's called the Healthcare Price Transparency Act. The act would require all medical facilities to post payer-negotiated rates for shoppable services so you could find the most inexpensive way to take care of your medical needs.
We've all been blind to know prices in healthcare before we get care. And then we've been blindsided by devastating medical bills, many times more than we ever expected to pay.
Cynthia Fisher is the founder of PatientRightsAdvocate.org. She says where employers have already worked with providers to show those healthcare costs up front, it has been a huge success for patients.
We know employers have been saving 30 to 50% for their workers and their employees on healthcare costs by contracting with price transparent providers.
Let's say you need a knee replacement before setting foot in hospital number 1, which charges $60,000. With this new act, you could go online and find hospital 2, which charges $50,000, so you would know what you would be getting into before going under the knife. On the flip side, hospitals say the rule could be a huge burden, especially while battling the coronavirus epidemic, and that hundreds of rates would need to be posted for every plan, including Medicare. Fisher says 9 out of 10 Americans support the law.
Americans want to be in control of their very precious hard-earned healthcare dollar. And when we can shop, Americans know we will drive down both the cost of care and health coverage.
In 2019, Governor Abbott signed Senate Bill 1264, which aimed to stop surprise medical billing in Texas. This new act would do the same thing for the entire country. We'll have the link to information about the act with this story on KENS5.com. Jeremy Baker, KENS 5 Eyewitness News.